My name is Emily Anderson and I'm a second-year nursing major. I am going to talk today about nursing. What is nursing? Why do we need nursing? We are going to talk more specifically about life flight nursing also. You see, nursing has so many different areas to work with. We got pediatrics, geriatrics, military, VA, clinical. Even more specifically in hospital settings, we got ICU, PCU, neonatal, and so on. Nursing is an all-around need, and that's why we are always in high demand of nursing. So what is nursing? Nursing is the profession or practice of providing care for the sick and infirm. In other words, nurses save and improve lives as frontline members of health and care delivery team. They independently assess and monitor patients and taking a holistic approach to determine what patients need to attain and preserve their health. One of the most important roles of a nurse is to be the patient advocate, to protect the interests of patients when the patient themselves cannot because of illness or lack of health knowledge. Nurses empower patients, guiding them towards healthy behaviors and support them in the time of need. When patients are able, nurses are encouraged to teach them how to care for themselves. Nurses provide physical care only when patients cannot do for themselves. As patients near the end of their lives, nurses provide dignity in death by advocating for sufficient pain, medication, and opportunity to die at home to allow them to spend meaningful time with family members. In the final days, nurses are there through thick and thin, good for worst. Not only is it the most demanding job, it's one of the most exhausting yet rewarding jobs. Now, life flight nursing. The reason I chose this subject is because I want to pursue a career in this field. So I take so much interest in this. Life flight nursing is one of the toughest adrenaline-rushing, important jobs known to nursing. We use the life flight helicopter to transfer a patient from a smaller hospital to a bigger hospital. The first transfer of a patient by helicopter was on January 10, 1967, according to OSF. This transfer was to deliver a premature infant from one hospital to the next. Those few moments that you are up in the helicopter are the most crucial minutes to save that person's life. You need to be well-skilled and adaptive. To become a flight nurse, you need to complete your RN schooling with a minimum of 5 years of experience in either intensive care unit, emergency department, or trauma. Afterwards, you will need to get about 5 more certificates and pass an annual fitness test. As you learn, the process is long and hard, but this is a very stressful job that the nurse needs to be well trained in. Nursing is one of the toughest jobs, but yet is the most rewarding. Thanks for listening.